In 1865, a skull arrived in New York from Peru with a perfect rectangle cut into the bone. The edges had healed. The patient had survived. That skull was over 5,000 years old. While Fred Flintstone was riding a brontosaurus to his quarry job, real Stone Age humans were soaring into each other's heads and pulling off successful brain surgery. And here's the part that makes this story truly unhinged. Their survival rates would eventually rival those of Civil War field hospitals. Stay right here, because Bedrock has nothing on reality. So let's start with the question that sounds absolutely insane. Could a caveman really crack open your skull? And have you survived to tell the story? The answer, backed by thousands of archaeological specimens, is a definitive yes. The procedure is called trepanation, and it is the oldest known surgical practice in human history. We're talking about deliberately cutting, scraping, or drilling a hole through the skull of a living person. Not after death, not by accident, on purpose, with intent, using stone tools. The earliest confirmed case dates back roughly 7,000 years to a site in what is now France. But evidence of trepanation has been found on literally every inhabited continent: Neolithic Europe, pre-Columbian Peru, ancient China, sub-Saharan Africa. This wasn't some one-off accident by a curious caveman who got too creative with a sharp rock. This was a global phenomenon. Different cultures, separated by oceans and millennia, all independently arrived at the same conclusion. Sometimes you need to open up the skull. And they didn't just attempt it, they succeeded. Researchers studying trepanned skulls look for something very specific: bone regrowth around the edges of the hole. New bone tissue means the body was actively healing, which means the person lived for weeks, months, sometimes years after the operation. In some Peruvian collections, the survival rate for trepanation exceeded 80%. 80%. Surgeons during the American Civil War, working with metal instruments, anesthesia, and at least some understanding of infection, had survival rates for similar cranial procedures that hovered around 50%. Stone Age surgeons, working with obsidian blades and no concept of germ theory, were outperforming them by a wide margin. Fred Flintstone's most advanced medical technology was a bird that worked as a record player needle. Meanwhile, real prehistoric humans had developed a surgical tradition so effective it persisted for thousands of years. This raises a bigger question: just how wrong did the Flintstones get real Stone Age life? The answer is almost cosmically wrong, but in a way that actually reveals something fascinating about how we think about our ancestors. The Flintstones, which debuted in 1960, was never trying to be accurate. It was a suburban sitcom with a stone veneer. Literally, the honeymooners with dinosaurs. Fred and Wilma live in a single-family home with a two-car garage, attend drive-in movies, go bowling, and order takeout. The joke is the juxtaposition: modern suburban life, prehistoric aesthetic. Dinosaurs are appliances, animals are labor. Everything runs on foot power and animal abuse. But here's what's interesting: the show accidentally got one thing philosophically right, even while getting every detail wrong. It assumed prehistoric people were fundamentally like us: social, clever, interested in comfort and community. And that's closer to the truth than most people realize. Real Stone Age humans were not the grunting, club-dragging brutes that Victorian-era scientists imagined. They were anatomically modern humans with the same brain volume we have today. They made jewelry. They painted elaborate art on cave walls. Lascaux, Altamira, Chauvet, work so sophisticated that Picasso reportedly visited Lascaux and said, "We have invented nothing." They buried their dead with flowers and tools, suggesting belief in some form of afterlife. They navigated open ocean. They domesticated wolves into dogs. And yes, they performed brain surgery. The Flintstones gave us Stone Age suburbia. Reality gave us something far more impressive: Stone Age civilization. So now the really provocative question: why? Why on earth were prehistoric people deliberately cutting into skulls? This is where it gets genuinely debatable, because the honest answer is, we're not entirely sure, and it was probably multiple reasons. The most widely accepted theory is medical. Many trepanned skulls show evidence of prior trauma: depressed fractures, cracks, signs of blunt force impact. In these cases, trepanation may have been a practical response to head injuries. If a piece of bone is pressing inward against the brain, removing that fragment could relieve pressure and reduce swelling. This is, remarkably, not that different in principle from a modern craniotomy. These prehistoric surgeons may have observed that people with certain head injuries died, tried removing the damaged bone, noticed it sometimes worked, and refined the technique over generations. But trauma doesn't explain every case. Some trepanned skulls show no sign of injury whatsoever. This has led researchers to a second theory. Ritual or spiritual purposes. In many ancient and indigenous cultures, illness was understood as spiritual affliction. Evil spirits inhabiting the body, particularly the head, cutting a hole in the skull, might have been understood as releasing those spirits. Several skulls have been found where the removed bone disc, called a rondelle, was shaped and drilled to be worn as an amulet. People were literally wearing pieces of other people's skulls as jewelry. That's a level of accessorizing that even Wilma Flintstone's bone necklace can't compete with. A third possibility is that trepanation was used to treat chronic conditions, severe headaches, epilepsy, mental illness. We have ethnographic accounts from as recently as the 20th century of trepanation being practiced in parts of Kenya and among indigenous groups in South America for exactly these purposes. The truth is probably all of the above. Different cultures, different eras, different reasons. But the surgical technique itself was remarkably consistent, which tells us something important. Knowledge was being transmitted. These weren't random acts. This was learned, practiced, and taught. Here's the question that really keeps archaeologists up at night. How did they actually do it? No metal scalpels, no anesthesia, no antibiotics, no sterile operating rooms. How did 80% of patients survive having their skull opened with a rock? 4 techniques have been identified from the archaeological record. Scraping, where the surgeon gradually abraded the bone with a rough stone until breaking through. Grooving, where a sharp tool was used to cut a circular channel deeper and deeper. Boring and cutting, where small holes were drilled in a circle and then connected. And linear cutting, where intersecting straight cuts created a removable square or triangular flap. That rectangular hole in the Peruvian skull that started our story, that was linear cutting, precise, deliberate, geometric. The preferred tool in many regions was obsidian, volcanic glass that fractures into edges sharper than modern surgical steel. Electron microscopy has confirmed this. A freshly knapped obsidian blade can have an edge just a few nanometers wide. Surgeons today have experimented with obsidian scalpels and found they produce cleaner cuts with less tissue damage than metal blades. As for infection, this is the genuine mystery. Some researchers believe that certain herbs used by prehistoric peoples may have had natural antiseptic properties. Others point out that scraping, the slowest method, also had the highest survival rates, possibly because the gradual approach generated less trauma and allowed the body's immune response to keep pace. There's also the simple possibility that if you kept the wound clean and covered, the human immune system could handle the rest more often than we'd expect. The evidence is undeniable. Over time, techniques improved. Earlier specimens show rougher holes and lower survival rates. Later ones show clean, precise openings with extensive bone regrowth. These people were learning, iterating, getting better. That is the scientific method in action. Thousands of years before anyone thought to name it. One final question: if real Stone Age humans could perform brain surgery, what else could they do that would make Fred Flintstone feel like he wasted his entire prehistoric life at that quarry? Quite a lot, actually. Neolithic humans built Göbekli Tepe in modern Turkey around 11,600 years ago. Massive carved stone pillars arranged in circles, predating Stonehenge by 6,000 years and predating agriculture itself. They constructed megalithic tombs that aligned with solar and lunar events, meaning they had working knowledge of astronomy. They developed sophisticated trade networks spanning hundreds of miles, trading obsidian, shells, and flint across regions. They fermented beverages. The earliest known alcoholic drink dates back 9,000 years to China. They even practiced dentistry. A 13,000-year-old skull found in Italy showed evidence of a cavity being deliberately scraped out and filled with bitumen. Prehistoric dentistry. Fred Flintstone used a woodpecker as a jackhammer, but apparently never thought to visit a Stone Age dentist. The Flintstones is a masterpiece of comedy. But the real Stone Age didn't need a laugh track. It had innovation, artistry, medicine, engineering, and a surgical tradition that lasted longer than the entire history of Western civilization. So here's what I want you to argue about in the comments. Given that Stone Age people clearly had the intelligence and skill to perform complex surgery, build monumental architecture, and develop trade networks, why did it take thousands more years for civilizations as we recognize them to emerge? Was it missing technology, missing population density, or something else entirely? Drop your theory below. And if you want more stories where real history makes fiction look boring, this channel is where that happens. Hit subscribe so you don't miss the next one.